Good morning, everyone, and thank you so much for joining us here today. My name is Jason Copping. I'm the Minister of Labor and Immigration and the proud MLA for Calgary Varsity, this riding, which includes the University of Calgary. I'm pleased to be here today with my colleagues, Minister of Health, Tyler Shandro, and Minister of Infrastructure, Prasad Panda, to announce an important project that will improve access to health services for patients and families from central and southern Alberta. I am so excited about this project that will spark developments in Calgary that will benefit Albertans, Canadians, and people around the world. I want to thank the University of Calgary for hosting us here in the Health Research Innovation Centre, and a special thank you to Dr. Sid Viner, the Calgary Zone Medical Director for Alberta Health Services, Dr. Ingrid Kozlowski, Director of the Calgary Radiopharmaceutical Centre, and medical oncologist Dr. Stephen Yip, who all will say a few words about what this new project means to Albertans. I'm also pleased to welcome Brett Wilson here today, whose name may sound familiar to you from CBC's Dragon's Den. Mr. Wilson is an entrepreneur and philanthropist who will say a few words about his cancer journey and the importance of cancer care for Calgary. It's always important to hear directly from patients like Mr. Wilson about how Alberta's healthcare system can best serve them on their journey. And with that, I'll invite my colleague, Minister Shandro, to the podium to share more on today's announcement. Minister.
Well, thanks, Jason, and good morning, everyone. I'm so pleased to be here, and I hope everyone is having a great stampede and a fantastic start to the summer. As I said, I'm so pleased to be here, to be able to add to the summer celebrations by announcing an exciting new project that will provide Southern Alberta with a new and with a modern health facility. And this new facility will boost access to products key to the diagnosis and treatment of cancer, heart conditions, as well as neurological conditions. And this project will also spur world-class research into radiopharmaceuticals and nuclear medicine. Alberta's government is committing more than $18 million over the next 3 years to begin building the first cyclotron here in Calgary. And this will include a new radiopharmaceuticals facility, which will create a special class of drugs that help diagnose and treat a variety of medical conditions, including cancer. Now, nobody wants to face cancer, epilepsy, a stroke, or dementia. These are truly frightening, life-threatening, and life-altering conditions. But for those of us who do, it's vital that we have access to robust tools which can help diagnose these medical problems or find tumors as quickly as possible, and then to guide the targeted treatment. Calgary and Southern Alberta have always had to rely on the cyclotron in Edmonton's Cross Cancer Institute, as well as places like the Chalk River Laboratories in Ontario, to provide the key radiopharmaceuticals that are used in the diagnostic tests, such as PET scans, that is the positron emission tomography imaging scans. But while the cross-cancer cyclotron can handle the demand, the radioactive nature of these medical agents means that they have a very short half-life and that they degrade on their journey south from Edmonton. So this means that only 25% of the agents that arrive can actually be used here in Calgary. So with the new cyclotron in Calgary, Alberta Health Services will now have a local source to develop the radiopharmaceuticals which they need for patients and families from southern and central Alberta. And as well, if Edmonton cyclotron is shut down for planned maintenance or if it encounters a production problem, Albertans will still have a secure supply from the Calgary cyclotron. The new cyclotron will mean shorter wait times for people needing scans and fewer postponed tests because of supply issues during shutdowns. A new radiopharmaceutical facility also means that Calgary will be able to spark new, cutting-edge research to discover and to create unique radioisotopes. Now, since the compounds will be created locally here in Calgary and they can be used almost immediately, next generation isotopes with even shorter half-lives of 20 minutes or less can now be explored. Emerging research from around the world indicates that new radioisotopes used in PET scans may be able to more quickly detect buildup of proteins in the brain, which could lead to faster diagnosis of conditions like Alzheimer's or Parkinson's disease. New compounds or radio tracers that are targeted to collect in specific tissues or specific organs, such as the liver, the prostate, or the heart, could help us to better understand the development and the progress of medical conditions in the body. Now, Calgary will be able to participate in this global work and will be able to attract scientists and medical experts from around the world. And this project is part of the historic commitment by Alberta's government to build and to support a world-class health system centered on the needs of patients and families. Now, through Budget 21, we're investing $3.4 billion over 3 years in capital funding for health facilities like this one, as well as for equipment and information systems. Here in Calgary, just to remind folks of some of these examples, we're redeveloping the intensive care and coronary care units at the Rocky View General, and as well, we're expanding the neonatal intensive care unit at the Foothills. Projects around the province are renewing and they are modernizing hospitals and health facilities in smaller communities as well, including in rural areas. Now, I was just last week, just in High River and Claresholm to visit some of these projects. And next week, I'll be in central Alberta visiting some more. And we'll continue to work hard to build world-class facilities that are built around the needs of Albertans and their families, and to celebrate the facilities, the services, as well as the health professionals and the researchers that help us all stay safe and stay healthy here in Alberta. So thank you, and I'll now invite our Infrastructure Minister, Minister Ponda, to come up to the podium. Minister.
Thank you, Minister Shandro. Good morning, everyone. I hope everyone has been enjoying Stampede. It's wonderful to have some semblance of normal back in our lives. It's no secret that Alberta, like other provinces and countries around the world, has been hit hard by the pandemic and the unprecedented economic downfall. That is why this year's budget and the capital plan is focused on protecting Albertans' lives and livelihoods. Through those efforts, we are supporting more than 50,000 direct and 40,000 indirect jobs with our 2021 capital plan with an investment of $20.7 billion in the next 3 years. That's on the top of $10 billion unprecedented infrastructure investment in 2020. A key component of those efforts is investing in the health facilities and the public infrastructure that our families and communities need. To make sure we are ready as we reignite our economy and Alberta retakes our place as an economic driver in Canada. A key part of Alberta's recovery plan supports the government's commitment to build, expand, and modernize health facilities throughout our province. Minister Shandro mentioned a couple of those projects. There are many more than that. Right here in the surrounding area, you would see that beautiful Calgary Cancer Center. It's on time. It's actually ahead of time, and we are on budget. And we're also doing a cogen plant in Calgary Foothills Hospital. Thanks to my colleague, Minister Copping, the local MLA, for his strong advocacy for projects in this area. And those projects also include like the new cyclotron and radio pharmaceutical facility that we will build here at the Foothills Medical Center. That will provide Albertans with increased access to life-saving medical services and programs and incorporate new medical equipment and technology into Alberta's health system. The development of health facilities, schools, roads, and critical public infrastructure projects are a key part of Alberta's recovery plan and are attracting investment into our communities. These projects are not only addressing present and future needs, they are getting Albertans back to work and will keep them working at a time when they need most. This includes well-paid jobs in construction and associated industries such as development, design, and engineering. It is important to remember these projects not only create jobs during construction, but also bring long-lasting benefits to the community and ensure jobs in operations and maintenance long after construction is completed. An added benefit is that a good portion of the wages workers are making from these projects are staying in their communities, helping the local economy and keeping your friends and neighbors working and local businesses alive. I believe that we are taking the right steps to a revitalized Alberta, and you'll hear more about that when we relaunch our Alberta recovery plan and update you with the various projects across the province, whether it is health infrastructure, learning facilities, social infrastructure, and also the infrastructure required to recover our economy and grow. So we are building for the future and we are diversifying the economy to kickstart our economy and get Albertans back to work while preparing for the future. We will ensure Alberta is once again the economic engine in the Confederation. Thank you.
Thank you, Minister Panda and Minister Shandro. And thank you to our partners at the Cummings School of Medicine for their ongoing collaboration and support in hosting today's exciting announcement. Good morning, everyone. I'm Dr. Sid Viner, Calgary's own Medical Director for Alberta Health Services. On behalf of HS Board and our President and CEO, Dr. Verna Yu, it is my pleasure to join everyone in celebrating this tremendous investment in healthcare. Today's announcement will have a direct impact on the lives of many patients and researchers in central and southern Alberta. The new cyclotron and radiopharmaceuticals manufacturing facility to be established here in the Calgary zone is an essential component in the treatment of cancer patients and in the diagnosis of cardiac and neurologic disorders that will result in more timely care and greater efficiency. Radiopharmaceuticals are a special class of drug that can help diagnose and treat many types of cancers, bone and heart disease, strokes, epilepsy, movement disorders, and dementia. They are also required for PET scans, imaging tests that help reveal how tissues and organs are functioning. For cancer patients, PET scans are frequently used to monitor their response to therapy and can also be used to follow patients after treatment is complete to detect disease recurrence. Currently, Alberta's entire supply of radiopharmaceuticals produced using isotopes made on a cyclotron comes solely from Edmonton. But because radiopharmaceuticals do not last very long once produced, we've been unable to optimize their use in treatment or research applications throughout Alberta. Having a cyclotron in Calgary will significantly enhance patient care and support clinical research. Additionally, the facility will serve as an important backup to Edmonton should routine maintenance or other issues impact production there. Delivering world-class healthcare to more than 4 million people from all walks of life does not happen without strong partnerships between government, providers, and the community. In Alberta, we are very fortunate to benefit from these partnerships because they directly impact AHS's ability to offer high-quality care where and when it's needed. Today's announcement is an assurance that along with our partners, AHS continues to deliver patient-focused, quality health care that is accessible and sustainable for all Albertans. On behalf of everyone at HS, I would like to extend our gratitude to the Government of Alberta for their support and investment in healthcare. I would now like to introduce Dr. Ingrid Kozlowski, Director of HS Radiopharmaceutical Center. Thank you.
Thank you, Dr. Viner. The announcement to approve the funding of the cyclotron and radiopharmacy facility is really great news. This facility is going to make a big difference to the quality and accessibility of healthcare to all of southern Albertans that require it. For example, right now we only have access to one radiopharmaceutical, and that's called FDG. FDG is a great radiopharmaceutical. It can be used to diagnose a variety of diseases, and including cancer and a number of other diseases. But the problem with getting FDG, as it's already been mentioned, is we can only get a fraction of what is produced in Edmonton, and that's because it's decaying as it's being transported down to Calgary. And that means that we can only do a limited number of patients imaging with FDG every single day. Now, if we produce FDG on site, we can easily double the number of patients that we can inject with FDG every single day. So that will really help reduce wait times for the patients, and it will also be much more efficient because we can now tailor make and produce batches of FDG that meet the patient demand. But the real beauty of having a cyclotron on site is now we can produce a variety of radiopharmaceuticals, and these radiopharmaceuticals are not otherwise accessible to Albertans. So we can start looking at cancers that maybe FDG isn't that good at detecting, and we can look at other diseases like dementia, Parkinson's disease, mental health disease, cardiac disease. So that is what personalized medicine is all about. So on behalf of Alberta Health Services, I'd like to thank the government of Alberta for sponsoring this initiative. And on that note, I'd like to pass it on to Dr. Yip from the Cancer Center.
Thank you very much, Dr. Kozlowski. Good morning, everyone. I'm Dr. Steve Yip. I'm a medical oncologist here at the Tom Baker Cancer Center, and I'm also a clinical assistant professor here at the University of Calgary's Cummings School of Medicine. On behalf of the many patients in central and southern Alberta who depend on timely, comprehensive cancer treatment, I'm very excited about today's investment. The future Calgary-based cyclotron is an urgently needed resource for Alberta cancer care and associated research. It will have a major impact on the diagnosis, staging, and treatment of cancer, such as lung, bowel, and prostate cancer, as well as lymphoma. The current state of acquiring cyclotron products from other sites in Canada hinders our ability to provide optimal clinical care and impacts the potential to advance cancer care through important research activities. This investment of a local cyclotron will lead to greater long-term stability and greater access to PET-CT and specifically PSMA PET-CT imaging for our cancer patients in central and southern Alberta, including our regional and community cancer care centers. This imaging is not only required for cancer diagnosis, staging, and determination of patients who will benefit from novel cancer therapeutics, it is also an important catalyst in potentially producing new cancer therapeutics. The Department of Oncology and Charbonneau Cancer Research Institute stand together in our strong support of a Calgary cyclotron to meet current cancer care needs and to enable important research that will advance treatment and firmly establish the new Cancer Center here in Calgary as an internationally recognized center for cancer care excellence. Thank you to all of the multidisciplinary colleagues, collaborators, and patients who have supported Calgary-based cyclotron, and thank you to the Alberta government for this important investment. It is my pleasure to introduce Mr. Brett Wilson, entrepreneur, philanthropist, to share his story. Thank you.
Good morning. Because I'm not elected or employed, I'm unafraid of the social media trolls who may challenge my story. I just don't care. My story starts 20 years ago. But before I go into my cancer story, I want to say thank you to AHS and the people of AHS, political and medical, for bringing Alberta through the COVID challenge faster than any other province in the country. We have extremes on both sides complaining. I'm tired of it. I hope you are too. Now let's go back to my story. 20 odd years ago, I was diagnosed with prostate cancer, and I went through the conventional process of a biopsy, did all of that in Calgary, then decided to look stateside to see where things stood with experimental technologies like brachytherapy, and it was defined as experimental at that time. I chose to go stateside for round 1 of cancer, dealt with that. 14 years later, my PSA started to climb, so I went back and had an MRI done in Calgary. And I still remember the words. It doesn't matter where it was done or who did it, but the words were, "Nothing remarkable." 48 hours later, I was doing a PET scan with a precursor to PSMA, which is called C11 acetate, again, a radioisotope. C11 acetate showed that I had 5 tumors active. 48 hours after an MRI told me I had nothing remarkable to worry about. The reason I'm speaking here today is the issues challenged with recurrent prostate cancer. Finding and dealing and treating with regular first-round prostate cancer, Alberta has come a long way, and I happen to have stepped up with a legend in my mind, a guy named Doc Siemens, and we funded the Southern Alberta Institute of Urology, which has a high focus on cancer. But here we are talking about recurrent prostate cancer. With recurrent prostate cancer, if you can't identify the cancer, you're generally given, and I'm speaking about the men in this audience, you're given a drug called Eligard or similar to block your hormones, lowers your testosterone, puts the cancer to sleep, hopefully for an extended period of time. I was once told that a hormone blocking drug would assure me of another 5 to 8 years of living. Well, that wasn't good enough for me. So round 2, as I shared, I went down to Kansas City Medical, and ended up being treated using radiation tomography in a place called Southwest Oncology in Arizona. That was round 2. Round 3 was 3 years ago. Once again, we didn't have the tools in Alberta to determine where my cancer lay, and I was fortunate to get into the BC Health System, and I had a PET scan there. And sure enough, a tumor in my spine was active. Fortunately, we're blessed in Alberta with some extraordinary treatment protocols, and hats off without naming a bunch of doctors, but I went to the Tom Baker proudly and willingly for round 3. Unfortunately, and again, I hate to use a press conference for this, I'm here to announce that I'm in round 4 of cancer. And once again, because we don't have a cyclotron in Alberta that can supply the radioisotopes, I was in Montreal a week and a half ago, where it was very clearly diagnosed that down in my sacrum, lower part of the spine, I have another tumor. Where will I get that treated? Calgary, because we have the tools, the technology, and the people. And I'm delighted to say thank you, Minister Shandro, not Doctor, Minister Shandro and colleagues for bringing the cyclotron to Southern Alberta. This will save lives. I didn't want a 5 to 8 year diagnosis. I wanted a run to the end of an ordinary life. And with these sort of tools, we can offer that to men suffering from recurrent prostate cancer in Calgary and Southern Alberta. That's all I have. Thank you.
Thank you, Brett, and thank you for joining us and sharing your story. As my kids reminded me that the word cyclotron to them sounded like a transformer and an Autobot, mind you. But it's important for all of us to know what an investment like this 18.6 means from the perspective of a patient and how it's going to improve, make the scans more timely, improve how unique the scans can be, but also the more timely and innovative treatment. So thank you for joining us. And Dr. Viner, I think you used your current title, but you are going to be moving on to a new title. And did you use the new title? current title. So just to publicly congratulate you for joining us on. Dr. Viner is going to be joining us in the executive team with AHS, and so congratulations on your new role. And I'm looking very much forward to working with you and in your executive role in AHS. So thank you, Steve.
Thanks, Minister. Thanks, particularly Brett, for that story. We've got media on the line, so as usual, we would take questions from the phones. I don't think there are any questions on the phone right now, so I'll just go to the room. Is there anyone in the room among the reporters at the back who wanted to ask anything? Okay, sounds like we have no media questions at all, which is a first for me, but I'll take it. But I'll just do a last call. If any reporters on the phone were wondering whether they could get in, you sure can. And a last check in the room. I'm not going to tell a joke or anything to fill the time. If there's really no questions, then we'll wrap it up there. And thanks very much. Yeah, I know you do. That's why I'm wrapping it up there. That my little tap dance routine did kill enough time for a question. I think there's a reporter on the line with one, so please go ahead.
Yeah, the question is from Fakij. I'm sorry for mispronouncing this. Fakij Baj. Go ahead, please.
Dr. Big. Hi. Yeah, this is for Minister Chandro. We were just wondering whether Alberta has had to dispose any expired doses of AstraZeneca, and if you know whether any doses have expired and when they expired, and when we disposed them, if we did.
Did you catch that, Steve? No, you can. So there's maybe the audio wasn't very good in the room. Do you mind repeating that? I apologize.
For sure. We were just wondering if Alberta has had to dispose any expired doses of AstraZeneca. There were some reports that there were some doses in Canada that had expired and they've had to dispose them. So we were wondering if something like that has happened in Alberta.
If I understood the question correctly, I hope I did. It was about expiry dates for AstraZeneca. Most of our allotment as Alberta for AstraZeneca was kept with the National Operations Centre until we as Alberta needed it. So we looked at folks who had AstraZeneca as a first dose and chose to have Astra as a second dose, people who couldn't take a messenger RNA or just made the choice themselves. It was a smaller number than we have even expected. So for the appointments that we received from those patients asking for an AstraZeneca vaccine, we had those allotments from Ottawa brought to us here in Alberta for those patients. As we get any further requests for AstraZeneca, we'll be asking National Operations Centre to ship any further amounts of AstraZeneca to us. My understanding is that the expiry dates on many of those is the end of August 31st. In the past, Health Canada has looked at those expiry dates for other vaccines and looked at those vaccines from a safety and the efficacy perspective and determining whether any expiry dates ever need to be extended. I'll leave it for PHAC to make, or Health Canada to make those determinations. But I don't have any concerns at this time with the expiry dates for AstraZeneca with the amount of bookings we have for what we've got so far from patients. Is there a follow-up? Although we might have difficulty hearing you.
Nope, no follow-up.
Perfect, thanks.
Okay, thanks very much. Already checking on the line. It looks like there are no other questions, none here in the room either. So now we've given Brett another story to tell about the time he did a press conference and nobody asked him a question. So thanks again, Brett, for your story. Thanks to all our guests, especially the three docs from AHS, 3 cabinet ministers. Thanks all, and have a great rest of the day.